I'm going to describe the game, and then I'm going to walk us through essentially what the board is and how a round works. So the round itself is, you can think of it as a planning cycle, like say a 1 month or 3 month planning cycle. And the first thing you do is you make some investment decisions that I'll walk through in a second. And then something goes wrong in the health system, as things are always happening. That thing that goes wrong can be at a different level of severity. So when something goes wrong, I pull a shot card, and that's the issue that arises. Then I pull a severity card that shows you how serious the issue is. And then after something goes wrong, someone comes in to invest. It might be a university, it might be a donor, it might be the government itself, and invest in a new system that shows up. So that's the structure of a round. And then you make more investment decisions. And what the board represents is a country. So you'll notice there is a large target shape in the middle of the board. And at the very center of this, digital health system. So the objective is to get your system scaled to the national level. And you'll notice there's a grid here on the board, where each of these quadrants of the grid represents a different area of the health system. Those four areas that I mentioned very briefly in the presentation earlier, of distribution, allocation, demand, and verification. So these are all areas that you, as health system planners, need to be thinking about in the context of your vaccine delivery program. So that's what the grid is. So sort of areas of planning and focus. And then the rings represent the scale of the systems you invested in. The little colored chips in the board itself are types of digital health systems that might exist in the context of a country trying to do a vaccine distribution. So there's 4 types. There are messaging systems, which are the orange ones. This might be an SMS or a WhatsApp system that you could use to engage your health workforce, or you could use to message the population around vaccine hesitancy or rumors, things like this. The purple ones are analytics systems. So these are tools you might be using to help you understand the data coming in around your planning. So you could be looking at COVID epi rates, or you could be looking at supply chain distribution data. So analytics tools. The pink ones are electronic immunization registries. So these tools are used by frontline health workers, whether they're community or facility or full-on doctors, to actually track and manage vaccine distribution and delivery. I should say delivery, not distribution. And finally, the teal systems are supply chain or logistics information systems. So these are utilized to track every aspect of the supply chain, from purchasing to port of entry to national warehousing to district warehousing to last mile, and actually sometimes it even tracks down to the number of shots delivered. The pink are immunization registries. So this could be a tool like ComCare is an example of a tool that can be used as immunization registries. This might allow a health worker to bring up a patient's information, track the fact that they've received the vaccination, schedule the next vaccination, and track that. They're used frequently in the context of routine vaccine delivery for children all over the world. That's what this part of the board is. On the right-hand side, we have the health system failure bar. And so what this is if something goes wrong and you don't have an investment that can protect you from what goes wrong, there's a health system failure, and we move the ring up. And so essentially you have 5 chances before the Minister of Health is asked to resign to make your investments in a way that protect your population. And so the way this moves up is I would pull a shot card. And so the shot card would specify something that is going wrong within the system. Essentially, something will go wrong within the health system. It will be tied to an area of your health system and a type of system that could protect you against that. So this example is aggregate vaccination reports cannot be traced back to individual vaccine records if your health information systems, your analytics tool, doesn't exist at the level of the problem, which is determined by this card, so in this case, it'd be a pilot level, then you would have a health system failure. And so if that happened, this would go up 1. I know that with all games, hearing the rules is super confusing, but generally after you play around, it gets a lot easier. So bear with me. I'm going to walk through everything, but then once we play that first round, I think a lot of this is going to make sense. But so I pull a shock card, something's wrong in your system. I pull a severity card. It tells you what ring you would need to protect against to have that bad outcome from happening. And then if you're protected, this doesn't change. If you're not protected, this moves up 1. The other thing that happens is an investment comes in. So in this one, it says a large private pharmacy group introduces a new demand prediction model for supply chain management systems. And so essentially they're investing in a supply chain system focused around demand. And so that'd be added to the board. So that's the flow of a round. Every round, you as public health officials in the Ministry of Health get the chance to make 4 actions or investments each round. So the types of investments you can make, there's 5 types of investments you can make. The first one is you can add a system. So as you noticed in our distribution quadrant, we don't yet have a messaging system. So maybe we want to invest in a messaging system to be able to coordinate the various actors trying to distribute vaccines. So we can add a system to the board. That's one type of action. Another thing you can do is remove a system from the board or consolidate systems. So you'll notice in verification, there's 2 different immunization registries. And so it's not clear how we're going to get that data together. And it would make a lot more sense if we had a single immunization registry. So you can spend some money to work on consolidating the systems and having only 1 immunization registry for verification. So you can add a system, you can remove a system. The third type of action you can do, you can say, oh, our supply chain system focused on allocation is highly effective. We want to scale it. So you can invest for 1 action to scale to the district level. So you can scale systems. However, you can also scale to the national level. However, investing in a system that is at the full national level is a lot harder to do than one at the district level. So it takes 2 actions to get to national. So it would be 1 action to the district and an additional 2 to get to the national level. So add, remove, scale. And then there's 2 more types of actions you can do. If you only have 1 system of each type and they're all at the same scale level, you can invest in interoperability, which effectively links the systems in the different areas, the applications in the different areas of the health system. It allows them to exchange data. Investing in interoperability is timely, costly, and something that really requires real effort. So it also takes 2 actions to invest in interoperability. And then finally, the last thing you can do is you can invest in governance. So governance is something that oftentimes donors like USAID or myself underinvest in, but it actually requires time, effort, money, level of effort to really make governance processes work. And so you can choose to spend money investing in governance. And governance does something interesting in the context of this game. It lets you change what the investor card does. So if you'll notice, if I pull a random investor card, it might advocate for us, in this case, it actually is, in a messaging system for demand, which would add a duplicate system or create fragmentation in the system. It would add a duplicate application to our at the pilot level for demand. That's not something we want. We only want 1 type of system per area. And so the governance token that you invest in lets you change this investment. You can change it to say, oh, we want a messaging system, but we want it for a different area of the health system. Or you can say, oh, we don't want a messaging system at all. We'd prefer a analytics tool for tracking demand. So you can change the type or the health system area with your governance card every round. You also don't have to use it. If the investment that comes into the system is one that's beneficial, you don't have to spend your governance token that way. So quick recap, 5 types of investments you can make. The first is you can add a missing system. You can remove a duplicate system. You can scale a system. 1 action is to district, 2 more to national. You can invest in interoperability, link systems, or you can invest in governance. You have 4 actions each round, and you're going to be broken into groups, and each group gets to make a set of investments each round. So you are all working for a Ministry of Health in our country here. You all have some experience working on digital health systems, and the new Minister of Health that has recently joined the ministry, she's decided that digital technologies are going to be critical for getting the vaccines distributed that they're receiving from the COVAX program. And so she's reached out to the ministry, identified you all who are people who have some experience with digital health systems, and pulled you together into a task force and said, you need to really help us think about how we're going to be investing and planning for our vaccine distribution in country.